And we are live on Instagram waiting for Dr. Alia to connect with us. Hello, Dr. Alia. I hope you are well. We have to turn off the captions and waiting for Alia on Instagram to connect with us. How are you all? I hope you are well and enjoying lockdown. What can we say now? This is what we always say. Let's hope you are safe. Alia Melki, hi, you're waving to us. We sent you the invitation, waiting for you to join.
I'm waiting for request to be requested.
Looking forward to this chat. People were really waiting to. Alia, can you let me try again? I'm gonna send you the invitation one more time. Okay, let's see if you can join now. I resent the invitation.
Yep, I'm on.
Guys, if you have any questions, I want to ask you. Hello, Alia.
Hey, hello. How do you turn this around? All right.
Yes, we can see you. Before you introduce yourself, let me just welcome our guests on Instagram and on Facebook. We're broadcasting live on both, and please, I want to ask you if you have any questions to post them either on the thread on Instagram or on Facebook. We can read both in front of us. Hello, Dr. Alia Melki. Can you please introduce yourself? Tell us where did you study and what did you study?
How are you? Hope all is well.
Fine.
Yani, it's nice to always be with you on this talk show.
I look forward, and always our guests keep on asking about you, and those who attended your sessions on Facebook during the last lockdown, they keep on asking me to revert to you different questions about the back pain and about etc. So we're not going to deal with that now.
Yeah, that's nice. So thank you for everyone, all the fans. I'm Dr. Alia Melki, Chinese medicine or traditional Chinese medicine, specializing in acupuncture. I will do a small translation in Arabic, wakhzal abad. So acupuncture, and I studied in Melbourne, in Australia, and I've been in Lebanon for 15.2 months now. So coping, surviving, and holding on.
Excellent. Let me ask you, there are two questions we need to know. What is Chinese medicine? And then we move on. Yes, in general, what is Chinese medicine? Because it's not a field that is taught in Lebanon.
Unfortunately.
But I know that it is practiced in Lebanon.
Yeah. Well, Chinese medicine is a very ancient form of medicine that originated from China, obviously, about 3,000 to 5,000 years ago, which really they're unable to actually grasp exactly how old it is. Chinese medicine has branches of many things. One of them is acupuncture. The other one is herbal medicine. Tuina, which is a Chinese massage technique, kneading and pulling kind of techniques. And what else? We have cupping therapy. We have the martial arts, Chinese martial arts. We have like a Tai Chi and Kung Fu is all originated from China as well. There's many forms. There's moxibustion therapy, which is a herbal therapy that is like a cigar. It's made out of mugwort, and they call it moxibustion or moxa, and used for inflammation and warming the channels. Yeah. Many reasons why it's used.
What is your specialty? Which one is your specialty?
Acupuncture.
So when you say acupuncture, it means, did you have an overview with different things and then you have a specialty in acupuncture, or from the beginning you start acupuncture?
So how it goes is you study the Western medicine first to have a brief or overall outlook of the body, how anatomy, physiology. You have the disease processes and how it's explained through the West, and then transferred to the East in a totally different way, more of a philosophical translation and method. So treating the body as a whole, not individual, not separated. We are more holistically involved with the body and the mind.
Yeah, this is why probably, like, if someone has a pain in the knee, let's say, or the bottom of the foot, all the treatment will start from top to bottom. It's not like focused on one space of the body only.
Definitely, it's not focused on one place. It's we're trying to get to the root of the problem, the cause of the problem, and it's not using medication to numb the body, to stop the pain. We actually want to see where the pain is, feel the pain, and see where it's created, how it came about, and how to change the pain, the location, the intensity, the feeling of everything. So we don't numb the body. Yeah.
Okay. Alia, we have a fan. We have fans on following us, but we have a fan specifically, Fidel Rizq, Lina Ghanma.
Yes,
You're welcome,
hi,
everyone. You're welcome, everyone. Okay, Alia, let me ask
we have mutual friends. Okay.
Yes. When patients come to you, what should their physical or mental condition be for them to come to you? When do I know that, okay, I need to go see Dr. Alia?
Well, first of all, like I said, we don't really separate the mind from the body. Most of the time when the body is in balance, it's more like organ disharmony, which is also going to correlate to the mind, or the mind will correlate to the organs. So we have to kind of like send a link so they can meet again and collaborate with each other again. Otherwise, there's an imbalance which is going to cause disharmony. In Western medicine, disease. In our kind of form, it's dis-ease. So we don't really want to create disease like thinking. We want to create a healthy lifestyle, so that way we can get rid of any discomforts and keep the mind focused on positivity. Yeah.
Okay, but when would the patient go to you? Should he have any specific symptoms for the patient to choose?
Like when we have symptoms, means that the body is already imbalanced. But when you don't have to necessarily feel something severe in order to come to see us. It could be slight tension, headache, for instance. But where is it coming from? Where to treat the cause? There's specific points on the body where we will be needling to manipulate the needles and stimulate the chi, which is the energy field, the vital force, the power. It's what moves the blood. It's what moves the blood and sends it to the right area, right direction, in order to meet up with its organ.
Okay, so let me ask you, if someone just got out of a car accident, he had his operation, he starts physiotherapy, and at what point does he go to you? Someone who has pain in the neck, and we're not going to define the pain now because we're going to discuss it later. someone with just pain in the back, in the back, neck, shoulders, feet, etc., should they go to you? Someone who has pressure in their life, they go to you. When do you want the patient to contact you, and at what point do you want to see the patient? Let's see someone who had a car accident, since we started with the car crashes.
So, okay, like for instance, like motor vehicle accidents or trauma, when it's related to trauma, of course, when there's open wounds, you don't want to treat any kind of wounds because you don't want to have any risk of infection or anything. So when the body is more healed, and definitely you need sometimes not even hospitals. For instance, you just need rest, compression, ice. This is like the home care first. Unless there's severe problems, this is another, maybe another area of emergency medicine where you go to the ER. But when it comes to trauma, for instance, it could be a whiplash when the head goes up and down, and you injure the neck and the surrounding tissue, the muscles, and you cramp up with your neck, and then you cannot move from left to right. But definitely when there's maybe a fracture, this is something that you need to be careful with. This is not something to play around with. You got to really heal. Maybe you need to wear a brace, a neck brace, a body brace, thoracic brace. And then when body is healed, when there's severe pain, there's definitely need to pass 3 to 6 weeks after the accident, and then we can start to heal. But if there's no real problem, we can heal straight away. It just, the body needs time to prepare itself for healing.
Okay, and when a patient comes to you the first time telling you, okay, I have pain in my neck, how do you start the diagnostic?
This is probably 80% of people. They have this kind of tension. So most likely it's related to stress, to postural problems. A lot of people don't sit properly. They're, with text neck, now they've called it text neck, looking at their phone, their head is down, all the pressure is here on the back of the neck. So in order to get that, heaviness off your shoulder, you've got to move. So if they don't move enough and exercise, it's difficult for that to go. You got to stretch, a lot of stretching. But then again, there's a lot of acute pain that it's so difficult to move with or exercise with. That's when we come along and we do acupuncture, because it's not going to have any risk of inflammation. If you press on an inflamed point with massage or something, it may get worse. It may exasperate. So with us, it will be subtle energy changes in order for that blood to release from the area, the blockages, and movement of blood and nerve stimulation, muscular tonification, maybe some cervical or some osteo manipulation. It may be needed just in order to treat those stubborn areas, maybe calcification, and calcification is a big one with more like people over a certain age, because the stresses of life have come to them and restricted the neck due to stress or anger. It could be one of the factors also. So we're not getting into other problems. It's a basic kind of issue.
Basically, when a patient comes to you, like, it's the accumulation of two things. You have the it could be a physical condition, but basically, and most of the times, which is natural everywhere in the world, it's the life pressure, sometimes with some people it's more than others, it's the anxiety, especially that we are facing now, like especially us in Lebanon. We had the bonus of living the COVID stress and the stress,
economical.
the economical one. So we have a bonus more than anyone else in the world, I think.
And the political.
And the political. I put them all together, so I don't list them. It's too damaging to my health to list them.
It's a minestrone soup.
Exactly.
Bit of everything.
But basically, people at all ages, they go through emotional stress and emotional changes. You have, like, even at teenagers, with teenagers, you have the emotional pain, you know, the growing pain, we call it. Like, as they're growing, the changes that are happening to their body, to their mind, etc. But at a specific age, we start, since you discussed the calcification, this is something that is medical. Can we avoid this with specific exercises? Is it something you can work on and heal? Because as you know, many people, they tell you, I have, and the Beirut blast, exactly, this we will never forget. May their soul rest in peace, and the soul of the living as well.
Maybe live in peace.
Exactly. The calcification, specifically with age, you start living the calcification on the joints and on the ankle and on the shoulders. You feel like the mobility is starting to get more difficult. Is it something as well you deal with, or no?
Of course, you're okay. My calcification is also related a little bit to what you're saying is more like arthritis and rheumatoid pain, and that's due to inflammation, and it could be systemic, so it can affect most joints of the body. But most of the other pain or calcification is where the bones become fused, more or less like arthritis, but it's more thickened. So what we can do with calcifications or arthritis, the best thing is movement, exercise, warmth. You know, lots of water and good food, healthy food.
Okay.
The worst thing is wind, cold, and lack of movement, and anything that really makes the body shortened. You got to lengthen the body with and stretch and bring the blood to the area. Yeah, and warmth, because warmth will bring the blood circulation to the area. Not cold, unless it's inflamed. You will maybe have some cold, but most of the time, not acute arthritis. If it's acute, it may need ice, but if it's chronic, it's been there for a while, more warmth, more hot heat therapy.
Since we focused on the calcification today, let's speak a bit about calcification of the neck, of the lower, or the arthritis pain, etc. How do you work on it? Where do you put the needles? I don't want much details.
Yeah, no problem.
But I would like to know.
In a way, it's more like common sense when it comes to where I'm going to put the needles, because they're around the area to release the muscles if it's related to muscles and bone and tendon and inflammation. But the inflammation, I will stay away from. It will be more distal and near and far from the area, not on the area if it's inside.
Okay.
Because you want to move the whole area and open the channels of the whole area. And like I said, warmth, and also we look at the pulse and tongue. So if I can see
the tongue,
the tongue, the tongue.
Okay.
So the tongue is also the part of the body that you don't see. So when you release the tongue out, you can see areas of the body from the stomach, the intestines, the liver, where there's stuck energy, damp, like a cheesy kind of look on the tongue. That's also damp.
Okay.
That's also cold as well. It can be cold if it's white, if it's yellow, it could be dark. So we look at the tongue in order to know exactly which points we're going to use, along with the other points.
Diagnosis that you
diagnosis, tongue and pulse.
Tongue and pulse
as well, because the pulse is going to tell us a lot. The pulse is not the the medicine pulse. It will be the Chinese medicine pulse, probably 28 different pulses and texture. You know, the feel, the rhythm There's all sorts of things going on with
Where
the
do you
pulse
get it
that
from?
is going to define
Same place?
the radial area. Yes, the same where you are, exactly. The same place.
But what?
Yeah, but
what
we feel both sides.
You take.
They correlate to organs. Yeah, yin and yang, which is like the night, the day. We have to see how full on the energy is, where the blockages are, which organs are corresponding in the deficiency or excess or blockages, and then we will make the picture of where we're going to put the points and how we're going to help this person. Everyone is different. It's tailored to every single person, because your pulse is different to my pulse. Your tongue is different to my tongue, although we may have the same pain, same area, but we treat it different.
You do treat it differently. So let me repeat. When someone comes to you, the first diagnostic is of course, taking the history and whatever, but the first physical diagnostic is the tongue and
the tongue and the pulse.
The tongue and the pulse.
And you can also read from the body, from the face, the eyes, the lines on the face. You can see what's going on with the texture, with the color, with the complexion, constitution. How is their energy? How do they walk? And how do they talk? Do they talk a lot? Do they talk little? Are they shy? You know, there's a lot of things going on that can help us figure out what's going on in the body.
Okay, how long usually is the session?
It depends. The first time, you know, the history taking and the diagnosis, it may take up to 45 minutes to an hour, 1 hour. And some people want to explain more than others, and some people have more problems than others or conditions than others to treat. So we take them one step at a time.
Okay, can you work on two different areas of the body at the same time, or you go one at a time? Let's say, can you work on the shoulders and the lower back together, or you just do one after the other?
No, we can do it if it's in the same area. You're laying face down, we can do even the legs, the knees, the foot, the back, the lower. Remember, it's a holistic treatment. Right? But the back, it may be a muscular problem, pain, and so it's different to the front, because the back is more chronic, the front is more acute, more alarm points, more emergency points, you know, more emotional. Yeah. And the neck is also, you can be related to the sleep, so we may need to fix that as well.
Okay, you got me there, because now I was going to ask you, like we spoke about before we discuss how long does a patient need with you, how many sessions. I will get to that later. What I want to know, like the patients that would come to you, some of them will have physical cases, and others will have emotional that is causing stress on their life, not sleeping. How do you work on those cases, and if yes, how?
So we definitely will work on the emotional aspect, indirectly and directly, because some people will not talk about their emotions and they cannot express, and they don't want to talk about their emotions, but you can feel it in the pulse, in the way they talk. So indirectly, you are using acupuncture points on certain areas without having to explain what you're doing. You know, but in general, you're treating what they want. You want them, like they want you to treat. They came in for neck pain, but I see there's anxiety, there's insomnia, there's dizziness. That's all related. So there may be points in the legs, there may be points in the neck, there may be points in the hand. So it just depends. Yeah, but definitely treating emotional as well as physical and general. Yeah.
Okay, how do you deal if someone has insomnia and not being able to sleep?
Well, first of all, I want to know what are they on? Are they on heavy medication? Is their body needs to be detoxed? Are they stressed about something that has not had a resolution? They have not had a resolution, like resolving certain issues, family, work. You know, we need to get to the bottom of things. Although we're not psychologists, but a lot of the times we've been told that it's better than psychology because they didn't have to talk and they feel better. So yeah.
Okay,
Yeah.
but do you reach positive results with the patients with insomnia?
Oh yeah, there's a lot of positive results. At the same time, I don't like to deal with people who are taking medication to sleep. So I try to help them to kind of like help them remove or decrease the dosage for them to be ready to stop slowly. And help them sleep, give them tips on how to relax, sleep, regulate their times, also regulate their digestion is important, because a lot of people have digestive issues that they're not, they're not fixing. They're taking masalan Pariet or something to stop the acidity flow. You don't want to do that, because we want to actually get to the bottom of what is causing this problem. So when you're taking this medicine to cover up the layer, or to stop the acid reflux, or the indigestion or the bloating, you're on medication for so many years. Like if you're gonna get better, then how come you've been on it for so many years and you're getting worse? So the idea is to get them into a natural process of healing. Yeah.
Okay.
That's something that they have to understand. Like takes time, because we've been trained to believe that Western medicine is the key and taking medicine is the only way. Whereas it's not always the only way. There's many other ways to get the body healthy.
Yeah, there are many other ways. And just to let you know, during confinement, I've been following some yoga sessions online with a master from India. It's been really interesting. And I started at the beginning. At the beginning, I told myself, yeah, I'm glad I'm alone in the house, because like I was sitting the yoga position and whatever, and like focusing. But at the end, I truly started living it. And I was looking forward to the session to start, because like the fact of getting the sound out, and how he teaches you of getting this to get the sound out, like causing the pressure, as if it's coming out, as if you have pressure released,
Vibrations.
Yes, the vibration. Okay, now I get it. Okay. So it is the vibration. So it's really,
even with acupuncture, there's vibrations. When you're feeling for pulse, you're feeling for vibrations as well. With energy, it's all about vibrations. So if you're stressed, the vibration will be kind of like a stress vibration. If you're happy, it's going to be a happy vibration. So it's going to affect you one way or another. Yeah.
Okay, Alia, just give me a minute. Guys, hello everyone. I know many people are joining now on Facebook. I see it, and on Instagram. This is the session. It's called What About Your Health? And tonight we have Dr. Alia Melki talking about Chinese medicine and acupuncture. So if you have any questions, please bear with us. We're going to be together for the next 10 to 15 minutes. And next time we move to different topics next Friday. Alia, okay. So do you work on the vibration as well? You see, like I want to talk a bit about the emotional part of the emotional release of acupuncture. Because as you said, unfortunately, when I said we don't have the Chinese medicine part of our studies in Lebanon, it's truly unfortunate, because like sometimes like in the old time, they used to say they used to go to an Arabic doctor. The Arabic doctor used to fix the fracture. Okay, now they go to the hospital. There are different kind of medicine, and I think like there is like a respect to all studies, because at the end of the day, they all prove to be positive and efficient. So I want to know, I know, because I know that people like especially in Lebanon, they tell you it's like as if it's an over-the-counter medicine, the Lexotanil or the Xanax, where people just go directly, grab it, and start taking. I want to know how can does the acupuncture has an effect on the body for the emotional problems? How does it work? If I'm clear with my question, I don't know.
Yes, it's a good question. It's great.
Okay.
But
Okay.
first, I want to say hello to Joseph Jibrail, an amazing dancer, amazing person.
Nice.
تحياتي. Okay.
Nice, everyone. We have a lot of people with us, as you can see. We have a lot of people that joined us, and it's really interesting, and it looks like it's an interesting topic to all. Okay. Okay, waiting for Alia. She's reconnecting. I want you to know that next week we're going to have a very interesting session with Joel Farha. We're going to work on specific what are the 10 snacks you should keep with you. Let me resend Alia the invitation. Hold on. It looks like she got disconnected. Okay. And we have a very special surprise with Chef Joseph Mansour, who's going to be with us. Not yet, I don't know when yet. He's going to be with us. We're going to do something unique and very cute with him. And it's going to be like a table ronde. That we're going to be more than one person discussing food and nutrition. So we're trying as much as possible to remain active. And on Tuesday, we have a very interesting session as well with a specialist in the owner of Healthy Food. She's going to discuss how everything starts like health-wise from the feet up, and how to care for your feet. So we're waiting for Alia. Just a second. Somehow it looks like she's facing difficulties. We re-invited her. So Alia, back to you. Instagram, you're back. Hold on. Let me just reconnect you. Can you go back to the link I sent you on the email and reconnect to live stream? Now you look very clear. Actually, better than before. No, go ahead. Connect it. It has nothing to do with the connection. Just go back in. And we're still live, and we're going to discuss the last point. Hello, Rachel. Hello, Layla. We have a great group with us. We're going to discuss the last point today and leave the rest for next time. The last point today is how acupuncture works on emotional stress. How long does it need? If someone like has breathing difficulties, that are not medically related, it is not asthma, it is not, it's truly related to stress. And when stress don't stands in the way of you sleeping, and it causes insomnia. So those are points. What we're going to discuss basically is the effect of acupuncture on emotional stress. Are you still? Did you open your? Okay, we keep on trying. Meanwhile, you can, I wanted to have it as well for our Facebook friends, but if it's not working, let's give it a try one more time. So let me tell you, let me repeat next week's schedule. On Monday, we have something unique and cute about the 10 snacks you need to have and something cute for Valentine. On Tuesday, we have the healthy food owner. She's going to be discussing how to keep your body healthy through taking care of your feet, which is very important. She's a graduate, she graduated from Germany, and this is her specialty. On We have one more day with Chef Joseph where we're gonna have with Chef Joseph Mansour a very special occasion. We're gonna be having live cooking sessions with him, and we're going to discuss the food, the nutrition of the food that he's preparing, and how to fix it in a way. It's going to be like a table ronde. And on Friday, again, we will be with Dr. Alia. Don't forget that every Saturday, I will be introducing a new international author and their book. So it will be really interesting to meet me tomorrow as well at 7 and every Saturday at 7. So this is basically the week plan. If you want to forget it, let's just go into answering our question and continuing on Instagram. It's recorded anyway, so we can hear you. Yes, and how do you deal with it through acupuncture? Now I'm back with you. Actually, you're back with me because I didn't go anywhere. Okay. Okay, if we're gonna keep on having the difficulty, I'd rather keep this topic for next time because it's an important topic and I want people to know how we deal with it. Okay. Do you prefer we postpone it, Alia? Unfortunately, I cannot hear you. We can tell the network is very weak on your side. Unfortunately, Dr. Alia's network is failing us at a very important time, and that is how they deal with emotional stress when it comes to acupuncture. If the connection is going to remain like this, we keep this question for next Friday. Unfortunately, as you know, this is the time where everyone is online because of the confinement, and it is affecting all our sessions, and I don't want to keep you long. So, Let me see. We have a nice group of people that joined us today. I hope you are all well and safe. It looks like, unfortunately, we're gonna wrap it up for today. Let's give Alia one more second and see if she's gonna be able to join. Hello, Alia. Is there hope tonight for a better internet connection on your side, or it doesn't look like it? I have a feeling, I hate to not be totally positive, but sometimes we have to be realistic. It doesn't mean we're negative, it means we're realistic. And reality says that Dr. Alia is facing difficulties and she may not be able to join us. So let me end it tonight. I told you about next week's program. We will get back to you. We start with that part and we move on to breathing, neck pain, and we will have probably another session discussing the body cycle. For now, I want to tell you sweet dreams. Have a great weekend. Take care of yourself. And I will be seeing you tomorrow night at 7 p.m. When I introduce the new author. Take care, you guys, and have a great evening.